You walk in, you have no idea what the hell's going on. You just walk in there innocent. And we get all done and they tell me I can get dressed, and I turn around and there's a nurse, and there's a nurse, and there's a doctor. And she said, Carol, this really, we have something to tell you. And I said, well, it's just a cyst, right? No. So I look at the nurse and I says, it's a cyst, right? No. So I stood there. Like I said, it seemed like hours, and it was probably 30 seconds. And I just looked at him and said, well, what do I do now? What do I do now? Dr. Lynch looked at me and said, Carol, your life is now mine for the next year.
I got to know Carol at the beginning of her cancer experience. She would call me on the phone and we would talk for a long time. She was very distressed about the cancer initially. So I was an emotional support for her, as well as providing information. When Carol had a question about something, she felt free to call me and we would just talk. It got to the point where I knew who was calling as soon as I heard her say hello. I knew her voice.
We know that the best quality care for cancer patients is care that is multidisciplinary, that is coordinated, and that addresses all aspects of the patient's experience. Central to that is the patient navigator. Our breast cancer navigator, Heidi Eve Cahoon, meets with every patient, understands not only the diagnosis, their prognosis, and their treatment plan, but other aspects of their lives. Their physical needs, spiritual needs, emotional needs, financial needs, to make sure that we have addressed all of those in the patient's care.
We know that knowledge is power, so basically educating women as to what the recommendation is to the abnormal finding on the mammogram or the ultrasound, providing them with educational materials and going step by step over what the surgical referral involves and then what the actual biopsy involves. I think empowering them with that knowledge and helping them understand what to expect helps them be less fearful.
You come to Cooper Cancer and you come in and they say, hi, how are you? And you get a big smile and you get a hug from all the nurses, and when you leave you got somebody helping you pay your bills. You can't ask for anything more when you got something tragic like this going on. And it's scary, I'll admit right up front, it's scary, but mine was great.
I continue to follow along with them throughout their treatment and past their treatment. Survivorship is a big issue, and we here at Summa are concerned about our patients with their healing and recovery from breast cancer, not only through their surgery and treatments, but afterwards as they go on to their everyday life.
Last time I went to the oncologist, he took my paperwork and wrote in big letters across the front of it, cured. So I took it home and I framed it and hung it in my bedroom. I thought that was worth hanging up. I don't know what I'd do without my critters. And I don't know what my critters would do without me. But two of them would be out running around in the snow and cold and hungry, and that isn't going to happen, is it? No. No, that's not going to happen.